not necessary to go check it out. But we're here to do this for you this morning, and that's why we've got this guest waiting for us now. It is often said that regular routine checkup play a vital role in maintaining optimal health and preventing potential medical issues. So, in today's fast-paced world, as people chase things, they're chasing gradually towards an end without realizing because they've neglected a whole lot of issues about them, even when their body is calling for it. Now, according to a recent survey that is out there, it stated that only 50% of adults participate in routine health checkups annually. That's the crux of the matter this morning on Lagos Talks 981. So the year is just 3 days into it. So you still got 366 days to go. I've been joined this morning by Dr. Lilian Ochayi. Good morning to you.
Good morning. Good morning. Hello.
Happy New Year. Welcome to the show.
Thank you. Happy New Year to you too. Good to
So
be here.
let's cut to the chase and quickly get into the significance of routine annual checks for individuals. Why
Okay.
should we really bother about this?
Okay. Basically, they're very essential because they help to maintain the quality of our health in general. They help to identify risks, diseases at early stages, and this this just helps to prevent illnesses. We know the popular saying prevention is better than cure. So this brings that prevention into play where you're aware of things before they actually get to a point where they cannot be prevented, or in situations where you now need more money or you have to spend more to treat these illnesses when you could have prevented it when at a very early stage. So yeah.
All right, I like the listener to know that they will be part of this conversation. As a matter of fact, if you got questions for Dr. Lilian Ochayi this morning relating to annual medical checkups and how scared of these checks you are, please speak to the doctor and she may be able to allay some of those concerns you've got and why you should do it. So keep listening. But then the numbers for you to call will be on 01448 9981 will be where to call. I'll get the calls in at a time. And then also I would love to read messages relating to this conversation will be on 0809 444 0981 WhatsApp messages only. So, Dr. Lillian, there is this
Yeah.
issue with, let's bring it domesticated to us. And mostly people feel that if I don't feel unwell, I'm okay. Can somebody really feel unwell without, and that person is really sick and it just feels, yet it doesn't know about it. And then there's this fear of going to, for these annual checks. They would stir up things that would make us afraid and then push us earlier to, probably persons to the edge before they even get there.
Well, yeah, this is something that definitely we see a lot in our clinics. Most people feel that without having symptoms or noticing any signs, they feel like they don't need to present to a hospital. But it is not true, because there are a lot of illnesses that start, and in the early stages they might not present with symptoms that individuals can notice. And having investigations or tests done early enough can help to detect this. Then there's also family history. There are so many illnesses, cancers and so on, that just having a family history of them put you at risk of having them. So without coming to a hospital to have this screening done, the individuals would not know that this is coming ahead, and they need to prepare early. Or so basically, even with something as easy as blood pressure checks, people walk around with high blood pressures and they are not aware. They feel they need to have maybe when they start to notice a headache or something just feels unwell in their body, then they know they have to go. But it's not, they usually say that hypertension is like a silent killer. It just keeps increasing. And if you're not checking it regularly, it could get to a point where someone just eventually has a stroke or a heart attack, and everybody is wondering like, oh, how did this person just, slum, or how did this person just come up with this suddenly? So it's very, very important that the fear we have of, getting to the hospital and hearing something that we don't want to hear, it's very, it's a lot better to know these things early than to know it later, because then we might not be able to come back from it. Yeah.
Now, that leads us to the next question, which will be the regularity of this. How frequent should people go for these checkups in a year? Health checkups now.
Okay. So for general health checkups, at least once every year, individuals should have, these checkups. But then depending on whatever results they get from these checkups, it could increase the frequency. It could now be twice in a year or quarterly, but at least once a year, everyone should have checkups.
Okay, see, Dr. Lilian, there is this, it's an adage in a way. It said that an apple a day would keep the doctor at bay or keep the doctor away. So
Yeah.
if a patient now, let's say someone listening now say, okay, well, I do take a lot of apples, and so I'm sure I don't even need to see my doctor. So I'd like you to dissuade and probably speak to such an individual this time. And that takes me to the age. What has age got to do with going in for this checks? So I'd like you to speak to age at this time
Okay.
and the types of checks we come in for.
Okay. Okay, so as we know, the older people get, they're more prone to a lot of illnesses because the body gets weak and all that. And also with other illnesses like cancers and things like that, they progress or they present more in the older, in people that are older. So it's important that from in elderly people, they actually have checkups more frequently, even if it's twice a year and things like that. So for screenings that can be done, so there's a lot of them. There's cardiovascular checks to check for heart conditions. Like I mentioned earlier, the blood pressure checks. They can check their BMI. It's body mass index to where they check or if a person is within the appropriate weight for their height. And it can also check cholesterol levels, ECG for the heart. Then there's also cancer screenings for women and men. For the females, we have breast cancer screening. We usually advise that women have a monthly self breast examination. At our clinic is something we usually, teach women how to do this self breast examination. It's important that every woman knows how to do this. They can watch videos or also visit a hospital where a doctor can also show them how to. So they do that monthly, and then they can also come into hospitals yearly to have a clinical breast exam. Then there's also the mammogram where they can do this 1 to 2 years from age 40 and above. So below 40, they're not advised to have a mammogram because of their risk of the exposure to radiation and things like that. Then there's also screening for cervical cancer. It's the pap smear. So usually sexually active women get to do this every 3 years. So they have this exam, and then when they do the screening, if it's fine, till another 3 years, they get to do the screening 3 yearly. Then for the males, we have prostate cancer screening, testicular screening. This, they also can do this self-examination monthly. That's for the males. Then, other STIs also, STIs, these are generally for the younger, demographic, because they usually might be the ones with multiple or anonymous sexual partners. So at least once yearly, people should have these screenings, but people with multiple, sexual partners can do this 3 to 6 monthly, basically. So these are some of the tests or components of these examinations that can be done. Yeah.
All right, thank you very much, Dr. Lilian. Well, if you just joined in, you're listening to Lagos Talks 981, and the conversation this morning is the importance of routine checkups. That's medically now. There might be other checkups, but so that's why we're saying it's medical checkups. And that's why we've got a doctor in-house. So when we come back on the other side, we would love to hear from you. When was the last time you had cause to sit and look at your doctor in the eye and get that medical check done? We would like to know. And if you haven't, what's keeping you away from going to sit with your doctor, go for that appointment? It seemed like you are avoiding that conversation. Then, as for Dr. Lilian, there are some of these tests you've raised, and it seemed like with the passing days and years now, it looks like more people are falling prey and to cancers. But I'd like you to speak to that when we return.
Okay, no problem.
Check if it's in. Okay, I think I check. Just check. I think it says it's gone.
What does future forward banking mean to you? Speed, innovation, convenience, lifestyle goals, or just simply getting service that is designed just for you? Yeah, we thought you might like all of that and more. That is why we specially created Providence Bank for you to take care of your daily experiences. At Providence Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providence Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providencebank.com to switch to a future forward banking experience. Providence Bank. Future.
We're back in less than a minute, Dr. Lilian.
Okay,
Thanks so much for your patience.
no problem.
Follow up every sporting action and analysis. Every Monday, Wednesday, and Friday, 8 a.m. Providence Bank. Future forward banking.
We're smooth 98.1 FM. It's still Lagos Talks 981. It is the 3rd of January 2024. You might say there's still a lot of time left, and that's why we're bringing up this conversation this morning of the importance of routine medical checks for individuals. And Dr. Lilian, you're still with me. And as a result of listing out all of the tests available, I guess you've not exhausted all of the various tests people can go for. So it might seem that these tests are just so many. So where would taking one doesn't prevent you from falling into the other one? So is there something that a kind of test you just go for and that just gives you a general clean bill, and you can say the doctor has given me a clean bill of health, at least if I stay on the right side?
With cancer, yeah, there are specific parts of the body that they can occur. So it's not just one, there's not just one test that you can do to say you're clear of everything. So for instance, if it's the case of breast cancer, it's localized to the breast. So you definitely have to do tests or investigations that would check the breast, to check the tissues and everything, to make sure that, oh, there's no risk of this in the future or in the short period which, you know, you've done the investigation. So to say that there's just one that would cover everything, no, there isn't. So you have to do the specific investigations for, you know, the particular areas that usually are affected.
Dr. Lilian, there's something that is the trend that is going on, and we're losing men, vibrant men, the population in itself, to prostate cancer. Uh, Much like the cancers, you know, that affect women, it would seem that these cancers have got more attention and awareness compared to prostate cancer. Why is this so?
Okay, so basically, I think the major problem is awareness. You know, if people are not really aware of these things, they would not know in time. And this is basically where screening comes in. For instance, for screening for prostate cancer, men are supposed to have a yearly, you know, rectal examination and have blood tests done to check their prostate specific antigen, basically a test that helps us to know if if it's within the normal range. And this usually happens, you know, in elderly, like people over 50. So they are supposed to have this. So the same way women are, you know, being encouraged to do breast screening and cervical screening, men are also supposed to be encouraged. But because of, I think there's just a general reduced, or so to say, some low level of awareness, basically. So that's why we have more cases of that. So yeah.
This leads me to something you tapped on a while ago. It will look like people walk about with what you call high voltage in their system, and that's relating to the blood pressure. And boom, you
Yeah.
just suspect, and suddenly, would this account for why we just would see sudden deaths most often than not? And people come around and say, "But it was looking fine, and there was nothing wrong a while ago."
Yes, exactly. Yes. I've seen even recently at an outreach I went to, you know, we checked people's blood pressures, and you know, it was surprising. You're seeing people with very, you know, elevated blood pressures and they're unaware. So some, you know, you find out that they're even aware, but they take it so lightly and they feel like, you know, they've not started having any actual symptoms, or their body still feels well, so there's no cause for alarm. So then we had to educate them that, you know, because you're not feeling anything doesn't mean that it's not getting bad. And with hypertension, you know, it's when it gets to the point that you start feeling something, then it means that it's, you know, getting to that really bad stage, and you have to pray that, you know, it can be reversed. So basically, it's important that people check their blood pressures. You know, if you check your blood pressure and you see that it's within normal range, you can still do it once or twice yearly, basically. But if it's elevated, you need to go to a hospital, register in a clinic, and you know, the doctor would also give you regular appointments to come. And if it's at the stage where you need to be on antihypertensives, that's the medications that help to lower your blood pressure, then the doctors will also ask you to come regularly to monitor your blood pressure if the medications are correcting it well enough. And another thing with hypertension is our lifestyle. You know, that also has an important role, especially in the older individuals. Our lifestyle, our drinking alcohol excessively, smoking, you know, not sedentary lifestyle, like people that, you know, they don't work out, they're just you know, just going about their lives. Basically, this also increases their risks. And apart from the fact that, you know, if you're hypertensive, you have to be on medications, making changes to your lifestyle also plays a very important role in helping to manage, you know, people's blood pressure. So it's very important that we actually check, and not just for the elderly, but even people that are young also, because then we're in Nigeria, we go out every day, people are stressed, and stress it can also play a significant role in causing some of these illnesses and things like that. So yeah.
Okay, your last point already now would lead me to the next question, but at some point I would still have to go back to lifestyle you mentioned, and I was going to touch on diet. So let's just conclude this diet. What role would diet play in terms of helping people before they get to sit with you, to also, while you're doing your job, to help them see, look, the blood pressure is high? Does that contribute, aside from you've touched on alcohol now as, well, this is the season. They got into a new year already. So are you
Yeah.
killing the joy right now?
No, I'm not killing the joy, but I mean, there's still drinking responsibly, or so to say, right? So, and even if you're drinking for the season, basically it's not it still doesn't equal drink. There are people that actually just are out here just drinking like every day, and they don't really care about their health, and basically they feel like they're untouchable and stuff. But before coming to a hospital, they apart from alcohol, like I said, there's also smoking, right? Smoking can also affect and cause a lot of health issues, lung diseases, heart problems, and things like that. And basically, with diet, it does play an important role, because even with medications, when doctors prescribe medications and everything, they still advise and they still counsel that you also make your diet, you also make changes to your diet. Because even with the medications you take, if you're still, eating things you're not supposed to eat, if you're still taking alcohol, or still smoking and doing things like that, the medications are still not going to be as effective as they would be if you were, not, eating unhealthy. And so basically, diet does play a very important role. Lots of vegetables, fruits, even as people get older, we usually advise that they put less salt in their food, things, so that it's because this also has a role in increasing blood pressure and things like that. Yeah, so it does have a very important role. Yeah.
Well, this salt issue you've raised now would touch on a lot of persons on the table and say, well, so what's really, let's just give everything up for the doctor's sake so we stay alive. Because there are some persons who, when the food is even ready on the table, you've got salt on the table there also to go, just to make sure you
Yeah.
plug that end. So talk to us about consumption of salt.
Yeah, so it's not basically to say that don't take salt, but it's just that in high amounts, it should be minimal, because in high amounts, it can increase your risk of high blood pressures and also other heart issues that could arise from that. So yeah, it's not to say, there are patients that when you talk to them, they just go to the extreme and they're like, okay, no salt. But
Yes.
no, that's not what it is. It's just, in minimal amounts, just not to overdo it. Yeah.
Okay. So just like you to know, if you've got questions for Dr. Lilian Ochayi, a public health physician, to speak to her this morning, she will be willing to talk to you also a bit on 01448 But also, have you been for a regular medical check this year? Well, you might say it's just the third. We still have time. January is still just young. Well, just a reminder. And if you haven't, what's keeping you away from going to have that check? What are you afraid of? The doctor here may be able to allay your fears and see why you need to go and sit with a doctor to do that regular routine check. And of course, we also would love to read messages from you on 0809 will be where we'd like to see the messages come over to. And this leads us, at some point, we might not be able to exhaust this question, this next question, but then on the other side, you would help us finish it up. But so this next one, you talked about stress while speaking about hypertension. a while
Yeah.
ago, saying that in itself can be a contributory factor to it. So this in itself is mental health. I was waiting to hear mental health. It was when you mentioned stress, and then
Yeah.
mental health came to mind. So talk to us about, isn't it also necessary at the end of the year to sit also to check for mental health right now? Sanity.
Yeah. Okay. Yes. Yes. It is important. It's very important because um talking, like I did mention stress earlier, so this can, it has a lot of impact actually on our mental health. People, can just, be aggressive, fatigue, exhaustion, reduced, them not being able to sleep well. This also affects us generally. So yeah, when people are part of this wellness check, when they do the yearly check, they also, the doctors have this whole examination and even questionings and things like that, just to have a general idea of how, they're coping with activities around them. So yes, it's also important, and it's also in among the examinations and things that are being checked for. I just did not mention it because I was talking through, but it is very important. It's also very important. Yeah.
All right. On the other side, I got these issues we need to raise that relates to weight and some of those other
Okay.
issues that you would help us explore as people come in for their regular checks. But then, just to remind you, if you're listening right now, has there ever been a point where if you hadn't gone the minute you did to your doctor, it would have been a different case for you or someone you knew about or still know about at this time? I would like to hear such experience this morning, even as we talk about the importance of routine medical checks annually for you. Just as a reminder, it's a soft reminder that you need to do these things. So let's know about that. It will be important. We're Smooth 98.1 FM. On the other side, still got some more questions.
Future forward banking.
Dr. Lilian, would have a two
Yes.
minutes. We've got a 2 minutes break for you.
Okay. Okay.
Just have a 2 minutes breather, then we'll come back and then we'll be getting ready to wrap up. Final lap.
Okay.
Well done.
Thank you.
Speak with our business concierge on 0700 77
Mm.
684 387 or email businessconcierge@providencebank.com to switch to a future forward banking experience. Providence Bank. Future forward banking.
You're listening to the Smooth Breakfast right here on Smooth 98.1.
We're back. We're back shortly in less than a second.
Okay.
Yeah, we're good to go. So, we're smooth 98.1 FM. That's Charlie Wilson with that piece there. Ain't no stopping us now. But then you might remember, see, with a good health, doctor, who can really stop someone with a good health, really?
I guess nothing. I
Okay.
mean,
So this links us to, we're going to pick up the conversation from where you're going to wrap it up on stress and mental health. So it's stated now, we agree on this table that yes, there's also need for mental health checkups also.
yeah.
Okay, let's move on to another part, which is some persons, if they don't gain weight, they complain, they say, why are you don't have, you're just looking forever young, and would you add some flesh at least? Just shows that you might not be eating well. So I'd like you to speak to that because in one of your submissions, you had talked about the BMI, which has to do with the body index mass in itself. So speak to us about a healthy weight for a body or for an individual.
Okay. So, yeah, like I said, the body mass index is something that we use to know if a patient is within, is in their healthy weight range. So it's we use the weight and the height, So it's basically there's a range. So we have a range that if it's within a particular range, we can say, okay, this individual is in their healthy, weight range. But if it's higher, there's a range where it's overweight, and then there's a range where it's now, outright obesity. So then there's also the underweight classification. So basically, when people come in for checkups or even just hospital visits, we usually do that just to know if they're within the normal weight range. And yeah, so if people are actually aware of these things, then maybe it can put their mind at ease and they don't have to feel like, okay, they're too skinny or maybe they're too this or something. But basically we as doctors, we want people to be in their normal, BMI range. And if they're overweight or obese, there's a lot of health issues that could come up with that, heart issues, stroke, things like that. Then there's also diabetes and other things like that that could come up from being obese. So it's usually advisable that, people try to work around being in this normal and healthy weight range. So this is where, diet and exercise and, physical activities come into play.
Okay, how much of exercise, building from the last submission, exercise, at what point does it become harmful to the body in itself as a way of keeping the body mass in check?
Okay. So basically the importance physical activity obviously is very important, as we know, because it helps to improve muscle strength, boost endurance and all that. But then if you're doing it regularly, at least it helps to keep your body in check. But in cases where people are overdoing, I don't know, do you mean like if they're taking extra maybe supplements or things like that to build muscle or
That in
things?
itself, but of course, the lifting of the weights, of course, the
Yeah.
exertion on the body, how much of it can it take? Or it's just because exercise is good, then let's just go.
Yeah. No, obviously, like people actually just go all out and do extreme stuff these days because they want to build muscles and things. But basically, the essence of it is to, have regular physical activity to improve just have muscle strength, build endurance. And even when you're physically fit, like we're talking about these checkups and things, it helps to prevent illnesses and things from coming up. So basically, just the regular physical one is fine. Don't, unless people have their personal desires and want to overdo it, and then they could also now become pose some health risks to them at some point. But hey, what we usually just advise is just having regular physical activity, you know, just to maintain good health, basically.
Because most for people like us who refuse to get the packs, not even a two-pack in the first place, we're looking,
Yeah.
we like to get this kind of confirmation so that we also so that those on the other side who feel they've got six packs and they feel we on this other side. So we just like to get this, and so that what you said is loud enough, and so they now know too. But at some point, I'm trying to understand what's the difference between the muscle itself and even fat that people run away from, because sometimes I see the muscle and I see fat.
Okay. So everyone obviously has muscle and fat, but then we don't want fat to be excessive, basically, because these are the things that help, that basically block or prevent blood flow, and press on blood vessels, and cause some of these heart issues and even some other conditions that we're trying to prevent. So basically, we even when we're talking on diets, talking on avoiding fatty foods or oil or excessively like fried things, all these things are basically to reduce fat. And even part of this screening that we do, we check cholesterol levels too, which also helps to check if this is within normal range. So fine, we muscles are already they're there and everything, but fat also, we have them, but just we don't want them to be in excess. So those are the things that we're basically trying to control.
I have cholesterol somewhere. We mentioned it earlier on as part of some of the tests we need to go for as routine part of the year.
Yeah.
But because you talked about diet and eating conditions, and it's hard to convince people about this, but if they hear it from you at this point, it might come very handy. How harmful is it? Because it is the season, the chicken. If the chicken doesn't come with that extra layer, that layer of it, and they say it has lots of, and that in itself is what I like to have. Don't peel the chicken. I want that layer of skin to come with it. So is it? Speak to me about the cholesterol in that.
Okay. So basically, I know everybody likes most people do like chicken. I'm not really a fan of chicken anyways. But it does have, it does have its own nutrients. It has protein and all that. But then uh I guess so. What usually I would just advise is just to have, minimally, basically, not to overdo them. Usually, even generally, I usually advise that people have fish, as they are usually, as they are healthier, compared to all this meat and things like that. But chicken is good. It has fat, it has calories and protein and things like that. But then just to not be excessive about it, basically. Yeah.
Now, one more item before we go, but that will be on the other side. So we're just almost done with this conversation. But so far, Dr. Lilian Ochayi, you're making us see the reason why we need to go for routine medical checkups annually. So that final item on the paper for you this morning will be after now. So stay with us with Smooth 98.1 FM, and this is Lagos Talks 981.
Okay.
but it's directed by a bass range. When you walk, it is like watching a G clef stroll across an octave centered by a C sharp. When you talk, the cadence of your voice is a tenor saxophone, making love to a cello at perfect pitch. You are so smooth. That's why we keep it here on 98.1. This is just meeting, signing out.
Seriously, I belong to the chop better than. Now, why anytime I want chop like this, I be put better things inside. For my yam porridge, after I don't put my fish, I go pour eggplant, onions, tatashi, and cuckoo, corn season with correct noodles for that delicious taste. Because my people, good life now like where you chop better. Sama all your food with correct vegetables, come the dinner with no cube. For that ogbonge delicious taste. Today, chop better. Ladies, I need to do some work to shopping for my sister, and I really don't want to get market breakfast. That's so true. It's been on my mind for days. Hey, moms, leave the hassle to us. Get trendy, unique, and affordable school supply all in one place for your kids to show up in style.
That's right. Get more for less on your back to school shopping at Skid Store. Visit our website via www.skid.ng or outlets in Lagos, Abuja, and Port Harcourt to shop now. For inquiries, please call 0807 728 5058. One expert, take off into the world of casino games and find your new experience. Play a roulette and see if Lady Locks on your side, land winning combinations with slots, and hit the jackpot. Discover much more games on One Expert. Register on One Expert with promo code Casino NG and get a welcome package up to 700,000 naira plus 150 FS. Place a bet on the casino and be the judge today. Hurry up, the luck is waiting for you where fortune awaits. One Expert, bet responsibly. It's the cross. Let's start this R&B music. Oh yeah, it's the best of smooth R&B. Music doesn't change R&B in transitional lessons. Singing in melody and lyrics that mean something. So I use it for the night. Smooth session on Smooth.
We're back, Dr. Lilian.
Okay.
Smooth 98.1 FM. It's still Lagos Talks 981. And my guest this morning, Dr. Lilian Ochayi, is still with us. And we're looking at the importance of routine medical checks for individuals as they start the year. At least from so far, what she's mentioned, you can do this once in a year. That's how important it is. You can even do it more, depending on how the referrals you get from the doctor after the first one. So back to you, Dr. Lilian, this morning. The issue before us now is we looked at all of these other tests and things we can do to live a healthy lifestyle, getting to sit with a doctor to examine, do the examinations. Final one, with one sub under it, sleep. What is the place, or where is the place of a good sleep in all of these checks you're talking about? What's the use of all these checks without a good sleep?
Oh, obviously it's no use really. Everybody needs to be well rested for it's just basic, thing that helps with general health. Like we mentioned earlier about stress having an effect on our health. So if the body is not well rested, the energy that you need for the next day's activity, you would not have that, and it just, would keep building up. So sleep is very important, for everyone. So, and basically these days, I'm not sure so many people are getting enough sleep because of, stress, Lagos traffic, getting home late, having to leave very early the next morning. But as much as possible, we should try to at least, even if it's 7 hours or more, just try to make sure that we sleep every day.
Did you
So
just
yeah.
cut? Did you just cut the recommended hour of sleep by 1 hour to 7 Lagos standard right now, Doctor
Sorry?
Lilian? Did you just
Sorry?
read? Did you just recommend? Did you just there's been a reduction right now from what you said of the recommended hour of sleep to by 1 hour.
No, I said at least. No, we still
Okay,
have the eight. We still have the eight. But
okay.
I mean, I'm just speaking based on, the circumstances and, things that are happening here. But it's still the recommended eight. But I'm just saying that people should try as much as possible to have, good enough sleep, because this would also help, with better productivity at work, basically.
Now, where is the place of still in the domain of sleep? Is there a place for, cat napping and what is called siesta, even in a working life, to also help in mental health balance? Do we have time for that?
Yeah, they do have their benefits. They do have their benefits. So having time for that now, it depends on the individual, their workplace, if they're even going to have time for that. But it's they help to help people feel more rested, and they can get to finish their day stronger. So it does have its benefits, and if people get the chance to do that, it's advised that they do that, because they can, their performance at work, cognition and things like that can also be improved generally.
So we can throw that in between. We've got lunch hour, then
Yeah,
we can also go for
yeah.
siesta hour too. Max too will not hurt.
Yeah, but I'm not advising anybody to sleep or during work hours, so
Yeah.
I did not say that.
Now,
Yeah.
final place. This one is the final question. Now, talk to us
Okay.
about the importance of water in terms of helping achieve this healthy lifestyle we're talking about. Water
Okay.
intake.
Yeah. Okay. So water intake is, obviously something that don't may not really stress on, but it's very important. It helps to keep the body temperature, protects tissues and everything. And it's even, comparing that to other drinks that contain sugar, things and all those excessive things. Water is part of, the classes of food. So for it to be, among those classes, you can tell that it is very important. So it just helps, keep our nutrients moving through the body, oxygen, allows waste, the waste in our body to also be flushed out, through the urine and things like that. So if you're not well hydrated, some of these things cannot happen as they should. So yeah, it's advisable that we do take water as much as we're taking other nutrients, like I talked about in the diet, fruits, vegetables, and other adding carbohydrates and proteins and things. Water is also a very essential class of food that should be implemented, in our daily diet. Yeah.
And this is where we'll draw the curtain on Lagos Talks 981 on Smooth 98.1 FM this morning. But not before we say a big thank you to our special guest, Dr. Lilian Ochayi, public health physician, has been speaking to us on the importance of routine medical checkups for us this morning. Thank you once again. Happy New
Thank
Year
you.
and have yourself a great day.
Thank you. Happy New Year. Bye.
And that's the size of the conversation this morning. My name is Omatseye Atsenuwa. Good morning.
Okay. That's all. Hi. Hello. Hello.
Ladies and gentlemen, this is I think.
Hello.